There's going to be a day when someone you love is in a hospital bed, and someone else in your family asks, what do we do? And whether that moment is full of confusion or clarity depends on what you do today. This episode is about protecting your future self and your loved ones by putting a plan in place now. We'll walk through the documents you need, the conversations that matter, and how to turn something scary into something empowering. You don't need to have all the answers, you just need to start. So what happens when someone's at a crisis point and they don't have an advance directive completed? What medical care do they get?
The advance directive is a critical way for you to be involved in the decisions that are made about your care, even if you're incapacitated. So if you have not completed an advance directive and you're in a situation where, in a serious life-threatening circumstance or you're unable to communicate, that information's not there. And so decisions are going to be made without your point of view, without your preferences. And that's not what any of us want. We want to be able to get care that's consistent with our goals and our values. And an advance directive is a way to make sure that happens.
Yeah, absolutely. And I think you touched on a key point. It's not necessarily that the care you get won't align with your goals, but there's not a way of knowing. And so you're putting not only your care team in a position to make those choices on your behalf, but also your family and your loved ones might have to make those choices for you. And that can be really stressful. Oftentimes people are left with regrets or, wondering if they made the right choice, if they have to make that decision without their loved one's input. So let's back it up now that we've painted that more dire picture and talk about what it could look like if you do have an advance directive. And let's first talk about the process that's in place to create one, which is often referred to as advanced care planning. So I said process intentionally because this is an ongoing process that you engage with different family members or your care providers. But what does advanced care planning look like, from the physician perspective, but even from the individual perspective?
Yeah, I think a couple things to point out. Number one, advanced care planning is actually a covered Medicare benefit, okay? So if you are an older disabled person and Medicare is your insurance, and I think this is the case for most other insurers as well, those providers will get paid for the time spent working with you on an advanced care plan. So this is something that you should take advantage of because it's a covered service. There's reimbursement for this time and effort. So what a conversation around advanced care planning might involve is a little bit of a discussion about where a person's health is at today, like what are their current circumstances, what are their risks, what are some things for them to be on the lookout for. So, for example, if somebody has a serious chronic illness, let's say heart disease or neurological issue or something else, that's going to be part of the conversation. Is where things stand, maybe talk about some issues around, prognosis and expectations. But mostly this is about something that's going to happen in the future. It's about what would happen, and it's relevant for people that have no medical conditions. I don't think I have any life-threatening medical conditions right now, but I do have advanced directives. Okay, I want to be sure that my voice is heard on issues like if I had no hopes of really recovering from a condition, that whether or not I would receive things like intubation or ventilatory support, artificial nutrition, fluids, antibiotics, pain, treatment for pain. So these are the types of topics that would be part of an advanced care planning discussion. Also, in our work in care at home, it's not uncommon for people to express a desire for whatever can be done for them at home, that they want to be sure that if possible that they're able to remain in the comfort and dignity of their own home, and that can get expressed too in this process.
Yeah, that's so important, making the time to start to think about what your wishes are. So advanced care planning and advanced directives have a few different documents that are included within that umbrella term. So there is a living will, a healthcare proxy, or some way for you to appoint someone, a healthcare agent, if you will, to make decisions on your behalf if you're not able to any longer. And one of the critical pieces of that is that hopefully you have already discussed what your wishes are with that person. So of course you can scenario plan for some of the things that you've already spoken to, but there might be an unanticipated event. And if you've already talked through with your person about what you want for your care, they can make an informed recommendation to your care providers that can guide that care. So you're also empowering your loved ones to not be in a position, I think we mentioned this at the top of the episode, to feel like they have to make a decision on your behalf without knowing what you would want. So it's another important piece of the advanced care planning process.
Yeah, absolutely. I think, when we were talking earlier, I was focused on the what of the advanced care planning conversation, but maybe even more importantly is the who of the advanced care planning conversation. So when we think about a durable power of attorney for healthcare or a healthcare proxy, we're really thinking about who do we want to designate to make a healthcare decision in the event that we're incapacitated and we're unable. And I want to caution everyone to just, because it's easy to misunderstand what this means. This is not designating in the moment your healthcare decision making to somebody else. Okay, so you have a healthcare power of attorney, but as long as you remain able to make your own decisions, you remain you continue to have decision-making capacity, okay? You make the decisions. Nobody's going to go around you in your medical care to make those, ask somebody else to make that decision while you remain capable of doing so. That designation is for a time when you're not able to. Let's say you are unconscious, or you are, under anesthesia in a surgery, or you are, you have a progressive neurological condition like Alzheimer's disease or another type of dementia that leads to you being at a state in the later stages where you're not able to think the way that you would need to make decisions. So it's in those circumstances, not just today, that that power of attorney would be designated to make those decisions. Otherwise, it's going to go to some next of kin, the rules in your state around who might be the decision maker. Worst case scenarios is there's conflict and disagreement, and that can be very stressful for families. You talked earlier about what happens when you don't have this stuff in place. And one of the things that can go wrong is that families get frustrated. They're not sure what to do, and one person has one perspective and another has another perspective, and it can lead to stress and strife, and that's not what we want. So this process is really important. It's something to do on a good day, not a bad day. I think that this is where with a lot of issues in health and aging, we think about stuff when things are going badly. But actually, that's not the right time to be making these essentially strategic, planful decisions. These are things to think about when we're having a good day, when we are able to think through our relationships, think through our goals, our values, have time to talk about it, as you pointed out, talk about with whomever we might designate as a power of attorney. And this is different also, the term, we talk about power of attorney, these terms get confused a lot. One other thing to remember is that we're talking about a healthcare power of attorney. That might not necessarily be the same thing, for example, as a financial power of attorney. People might also want, and I would recommend, potentially designating somebody to help with financial management and other issues that come up if you're incapacitated. This is really focused on medical decisions, what we're talking about today.
Yeah, a lot of really important clarifying points that you just went through. So thank you for going there. Important for people to know that this healthcare agent kicks in if they are unable to make decisions for themselves, and not, like you said, as soon as the document is signed. To go back to kind of complete the loop on what forms are involved with advance directives, people have heard of that DNR, or do not resuscitate order, so you can determine what your wishes are there. And there's also a POLST, or whatever your state calls it, MOLST, there are all kinds of names, portable medical order, and that is the document that's completed with your physician's guidance. So again, you can determine what your wishes would be, document those, and all of those documents that we've just spoken about and the decisions that you're making get packaged up together, and that's what we're calling the advanced care planning process or the advanced directives that people will turn to if they need to in the case of an emergency.
Right. Those are important distinctions. And I would really recommend, for everyone to have a, durable power of attorney for healthcare, as well as a living will that states in advance some of your wishes and designates a proxy. I want to point out that a POLST or a MOLST, physician order for life-sustaining care, a provider order. I just want to point out with POLST and MOLST, these are not advanced directives. Okay, a POLST or MOLST, it's an order. Okay, this is your medical provider's order for the type of care that you'll get right now. Okay, so if you are living in the community or maybe in assisted living or nursing facility, whatever it is, that order for what would happen in the event that your heart stopped beating or you stop breathing, would you get CPR? Would you get intubated? What type of life support and medical intervention you would get. That is an active order. So those things, a POLST or a MOLST, they tend to be more relevant for people that have a serious illness, that or maybe they're of very advanced age, and they're at a moment where they really know about what's going to be helpful, what's going to be futile, what is consistent with their goals. And so that POLST or MOLST is going to be an order. And it's a bit different than a DNR, because DNRs or, do not resuscitate orders, historically and typically are hospital or facility orders. A POLST or a MOLST is portable. Not every state treats them the same. So you really do have to, know what is allowed and what is respected in your state. Maybe, Elyssa, if you could just share a little bit about where there are some resources so that people could figure out what types of documents are honored and what are the nuances on a state-by-state basis.
Yeah, I thought you'd never ask. I've been waiting to talk about this. But thank you first for providing those distinctions. I think all of those different documents and terminology are often swirled together and people don't really know where to start. So a good place to start that will have everything simplified for you is the Alliance's resource for consumers called Caring Info, caringinfo.org. Really easy. Type that into your browser and you'll be taken right there. And the site's available in English and Spanish, fully translated. There's a lot of information about planning more broadly, but there's also the only annotated library of advanced directives for all 50 states plus Puerto Rico and DC in both English and Spanish. All of that's available for free to download for any individuals looking to complete their advanced care plans. We also work with certain providers to provide those documentation, and they are updated regularly so you can remain assured that they are compliant and up to date with anything that's changed statutorily. But caringinfo.org is the place to go. There's a tab, but you'll see it right away for advanced directives. You can go there, you can toggle to your state, and you can download it immediately. And then actually that brings me perfectly into what I wanted to talk about next, because you might have think that you've done the work that you need to do. You filled out your advanced directive, but now what do you do? I mean, in order to make sure that the advanced directive is actually adhered to, people need to know about it. So if you haven't already had the conversation in tandem with your provider, you need to make sure that you do have that conversation. Same thing goes with your family members. Hopefully you're talking to them before you appoint them as your healthcare agent. But what are some of the ways that you could maybe talk to your provider about your wishes for care? Do you bring the advanced directive to them? Should you have that conversation at the beginning? How do you communicate your wishes so they don't just live on the page, but they're actually brought to life?
Yeah, I think your point about making sure that your healthcare providers have that information. Also, if you live like in a congregate care setting, like in assisted living or independent living, making sure that if they keep health records, that those are there. And then certainly key family members or anybody that might be, might get outreach to in a situation where they might have, a serious medical concern or complication arising. I think that it's a great thing if you have like an annual physical or checkup with a primary care doctor, your family doctor, or as you get older, maybe a geriatric medicine physician, if that's relevant. Having that as a structured part of that annual conversation and reviewing those wishes, I think is critically important. The again, the providers are compensated for the time they spend working with you on this. It's part of the Medicare program. And then, we talked about this is important on good days and planning ahead, but also we should note that if there is a change in your health condition, if you do have a new medical problem, or you are about to have maybe a medical procedure or surgery or something, that's another time to make sure these have been updated as well.
Yeah, that's an important point again. I mean, that's kind of why we say this is a process, not an event, because you have to complete the forms, you need to have the conversations before, during, and after, and then you need to make sure that as your condition changes, you're updating those directives. And if you do need to create a new form, even if you only have one change, make sure you complete an entirely new form and then distribute it as you would the previous form so that everyone has that latest documentation. But the other thing is that in the past, advanced directives were mostly paper. And it's important that you still, if you want to have those printed out, that is still one way to approach it. Give the paper copies to those in your life that need it. Make sure you have it in a cool drive, flood safe, emergency safe. If you need it on, quickly, you can access it location. But there are also ways to digitally store advanced directives now, which make things a lot simpler for some people who are more used to living in that digital space. So there's digital, and there's also video. So if you want to make a video of yourself documenting, and there are companies that can help with that, you don't have to navigate that yourself. That's another really exciting way to make sure that your wishes are heard. And Caring Info has a section of the website dedicated to the different people that you can work with. If you're looking for one of those more innovative ways of completing the advanced directive, if you think to yourself, I can't find a piece of paper that I want in a time of crisis, okay, well, let's make sure that it's in the digital device of your loved ones and yourself, so you're good to go when a crisis happens.
For sure. And, Caring Info, caringinfo.org is such an incredible resource. Tens of thousands of people visit caringinfo.org every month to get information about advanced care planning and other aspects of their care, and it's a wonderful resource. And the National Alliance for Care at Home is proud to offer Caring Info to the world, really, as a tool, as a resource. It is unbiased information. It's being done using the best professional judgment that can be brought to bear on these things. And your point about the videos or sort of digital wishes. I mean, listen, we have, in this world, more and more videos of ourselves, blowing out birthday candles.
Things we don't need on video, most likely.
There's a lot of things that just don't necessarily need to be stored for the ages. Like your chance to actually explain how you're thinking about, what you would want to happen if you had serious illness, if you were incapacitated. That's high value. That might impact, your own quality of life, impact your family's confidence in their ability to meet your wishes. Remember, another thing to think about in sort of our life's journey, in our legacy with our families is, what circumstances were they in at the end? Did they have the information they needed from us in order to make things, manage things as smoothly as possible? We don't want our family's last experience with us to be just filled with stress and uncertainty and doubt about what would have been the right thing to do. Giving them that confidence of how you would have wanted things to deal with in many ways is a gift. Yeah. And it's something that we shouldn't forget the impact on the people that we care about.
I love that you said that. I talk about it as a gift too. It's like the best last gift that you can provide. I know it's hard to think about that, but it's important that we do, and it's never too early to start to think about that and to have those conversations. One more point just about Caring Info and this conversation as well. For anyone out there listening, any consumers or individuals thinking about their own care or the care for their loved ones, this is a great place to start. But for our providers listening, Caring Info can also be a good resource for you and having those conversations with your patients. So there's information there about how to talk, how to have conversations between patients and providers. You can access the forms. You can use that as a resource because it's not easy to bring this up with patients as well. And especially if it's a circumstance in which the condition is changing for the patient and you think they might need to update their advanced directives because they have some new things to think about. So we understand that is an emotionally challenging conversation. So we wanted to create this resource to help guide you through that. That way, you feel confident in the conversations that you're having. and you know that your patients and those that you're serving are getting the care that they need and desire. I mean, that makes everyone's lives easier all around in an already very difficult time. So I think, to your point too about the gift, it's difficult. Don't be afraid, and don't expect the conversations to not become riddled with emotion, because it's likely that they will. But just starting this process is really important in safeguarding your future, your loved one's future, and just that takes away some of the anxiety and stress that you'll have to face in the moment.
Elyssa, I have a fear actually that people are not going to listen to this conversation because this topic is one where people tend to bury their heads in the sand, right? And they don't want to think about it, and the conversations and the topics are too difficult, and so they avoid it. And so I think it's possible we might have been working on the most unpopular topic and unpopular podcast episode that's ever been thought of because of human nature.
Yeah.
But I hope we're able to kind of turn the tides on that and actually make sure that this is something that people start thinking about and planning for. We talked a lot about, the medical resources, about carrying info. I would say another place to go that we haven't talked about is there are, people's attorneys, okay, can play an important role in some of these issues. It's not uncommon if somebody is addressing, planning for their finances or planning for an estate, that they may also discuss these kind of healthcare issues with their attorney, general family lawyers, also, elder law attorneys can be really helpful with this type of conversation.
Yeah, absolutely. I hope you're wrong about the interest in this conversation. The web traffic to caring info begs to differ. But if you are still listening, I'll just say kudos to you. I hope you're inspired to start your care plan, and thanks for having this conversation.
Thank you.
For our next segment, I'm excited to welcome to the show Dr. Susan Nelson, Chair of the Palliative Medicine and Supportive Care at Ochsner Health System and President of the National POLST Collaborative. Dr. Nelson is board certified in internal medicine, geriatrics, hospice, and palliative medicine. Over the last 30 years, she has advocated for systems to improve care for those with serious advanced illness, focusing on providing the best care possible through shared decision-making and open dialogue about what might happen next. Dr. Nelson, your work is really an inspiration for all of us, and I know our listeners as well. So thank you for joining today. We'll have some fun digging in.
Yeah, thank you for having me.
Earlier in the episode, Dr. Landers and I talked a bit about what advanced care planning is, why it matters, but I really think there's value in having listeners hear it from you directly. So how would you define advanced care planning, and how does it help patients in your eyes?
Yeah, so I think of advanced care planning as really thinking about the journey that we take throughout life. And so, I grew up in the Houston to New Orleans area. So you think about not going on a trip to Houston without figuring out where you're going to stop for lunch and, the things you're going to do along the way. So I really think of advanced care planning as patients, as they get older or they develop a serious illness, think about what's going to happen next and really look to the healthcare team to help them guide the way there. And so by having documents, that really makes it clear who is the boss, so to speak, of who gets to speak for you if you can't speak for yourself. And I think that's really important.
Absolutely. And we did also talk a bit about those documents, but I would, again, love to have your perspective, particularly on what a POLST or portable medical order really means. And I feel like there's different state by state, and there's the National POLST Collaborative. So can you break that down for us? I think people often confuse what that really means.
Sure. So the advanced care planning documents are really legal documents. So that's identifying who the healthcare power of attorney is, or the person who can make decisions for you if you can't make them for yourself. And certain states have a delineation of who those people are. Some states leave it as vague as the person who knows you best. And I don't know if you've been, in a family meeting or in my own family where somebody always thinks that they know best. So, So that's an important document. And then the second document is the living will. And that's really asking people to think ahead of time about sort of the line in the sand that they would draw on what would acceptable life look like. So, whether or not, if you had a serious head injury or something like that. And that's usually the line in the sand that people draw, would you want to be on life support? So those kinds of things. The POLST document, though, is really a medical order. So different than the other two, which are really legal documents that require interpretation. The POLST document is a portable medical order. And simplistically, if you think about it as a prescription that someone has that they can take to anybody in the healthcare system who can fill the order, so to speak. So it is usually for someone with advanced illness or frailty, who you wouldn't be surprised if they died in the next, 6 to 12 months. And different states have different rules on that. And it outlines the kind of care that you would or wouldn't want. And so, in the United States, the default is we do everything for everybody. So, if somebody, drops dead, then we start doing CPR on them and try to bring them back. But in some people who have serious advanced illness, CPR isn't going to change the fact that they have lung cancer and it's everywhere, and that's what's causing their end of their life. And so the POLST document actually allows people to delineate the kinds of things that they would or wouldn't want, going back to the hospital or not. And then there's also something on the document about feeding tubes and artificial hydration and nutrition, which is sometimes a source of controversy, but it's usually always something we talk about when we're talking about serious illness. And so in some states, they've removed that piece from it because it's not an emergency part of the conversation, but it is usually a part of the conversation. And maybe that needs to be a little more clarified.
Yeah, I love the analogy that you used as a prescription that can be filled. I think that's a really easy way for people to understand something that can often be misunderstood. I think we know why a lot of, well, maybe not why, but what a lot of patients and families misunderstand about advanced care planning. But I'm actually curious if you notice any persistent misconceptions around other providers. As a hospice and palliative care expert, you are well versed in this in ways that other providers may not be as much so. So is there anything that you see across the board that you often work to combat?
Sure. There's a couple of things. From a patient standpoint, a lot of times patients don't want to complete a document because they're afraid somebody's going to get their stuff or their bank account. And so really talking about that misconception that, some lawyers do make documents that are financial power of attorney, healthcare power of attorney, sort of like a run-on sentence, if you will. But from a physician's standpoint, or other healthcare providers, the confusion is, when do you enact it? What are the barriers? Will I get in trouble if I interpret this, incorrectly? And so, it really is used as a guide along with good medical care. I do think, certainly with the living will, that a patient has taken the time to create a living will, and we should honor that. And I think there are people who are skeptical that, they might have meant something different, if they were in the present moment. And I think of that about patients with dementia who create a living will before their illness gets worse, and that we should honor their wishes of the kind of person that they were when they created it, or any of us are when we create the document. We do know that there are people who, have been in a serious accident or something, and at one point in time, they might have said to somebody, I can't imagine living like this. And then if you ask them now, is their life okay? And they say yes. And so that's where some of the controversy comes in about whether people really understand what they mean when they create these documents.
Yeah, that's absolutely fascinating. I think it's surprising how often people are more resilient than maybe they themselves would have anticipated. So to have that fear of, well, what if I can't change my mind? Like, what if I need to change my mind? How do you address that? Is that a barrier that you encounter? And how do you typically advise folks then?
So I always encourage people to review their documents, sort of their birthday month. That's when, and I'll put a plug in, that's when you should get your mammogram and get a pap smear if it's indicated, or have your prostate checked or whatever on your birthday month. And so I always encourage people to check their documents. So, the person you may have as your healthcare power of attorney, maybe you're not married to them anymore, or, they've had an illness and they can't speak for you. Or you want to, you just want to change the order of people. And then also, in the living will era, I mean, I can think of, actually I had cancer 30 years ago and my kids were little, and the decisions that I made then were different, or may be different, I don't know, than they are now. And so I think depending on where people are in their lives makes a difference in the way they complete those documents, or, how things are going with their life and their family. We do think about, besides your birthday month, thinking of times when there's been a death in the family, or a divorce, or a marriage, or, kids going off to college, and, things like that. And kids going off to college really don't even think about the fact that, they're over 18 and mom and dad still gets to make decisions if they haven't appointed a healthcare power of attorney. So, they need to decide whether their brother or sister is the right person instead of mom and dad. And so it's just, different times in people's lives make different decisions.
Yeah, no, thank you for sharing a bit about your personal story too. And I like the birthday check-in. Happy birthday to you. Now complete your advance directives again. But, I think that resonates too with the major life events. I was a bit of an anomaly child because I was forcing my mom, after my father had died on hospice care, to complete her advance directives and go through all the documentation, because I was like, I don't know what I'm going to do. We need to have this conversation now. And then walking around to all my friends and they're like, well, I don't really want to think about this. I'm like, it's never too early to start planning. I mean, certain documentation, sure. But why do it at the time of crisis? Why not do it now when you're clear-headed and adapt as you go?
Well, and I think if we normalize the conversation of like, who would we call an emergency? If you get your blood drawn and you faint, who do we call? And certainly the airlines don't let you fly to Europe without putting the name of an emergency contact that's not on the plane with you. So, we do that sort of flippantly, but in healthcare, we probably should make more of a point of doing that. And we do have some standards when someone goes to what's a federally funded healthcare facility. So anybody who accepts Medicare and Medicaid, you're actually supposed to ask people if they have a living will or a healthcare power of attorney, and if they don't, would they like to make one? And that's as far as the law went. But that's hard for a lot of people to be fluent in the conversation about that instead of just handing people documents.
Yeah, that's actually a perfect transition to something else I want to talk about, because we've talked a little bit about the what this looks like, but not exactly how do we get from, point one to point two. And starting those conversations can often be really intimidating from all perspectives. So as a potential patient, as a loved one of a family member who you think might benefit, and even as a provider feeling like, this is just too much for me to take on. I don't have the time. I don't have the tools. So what practical tips, let's start with providers, because I think you have an especially valuable perspective there. What practical tips do you have for providers who need to initiate those conversations with their patients?
I think it's really just normalizing the conversation that, you're here for a annual wellness visit, or you're here because you're ill, or you have a new diagnosis, and say, I ask all of my patients all the time, how can I provide the best care possible? And one of those things is, who do I talk to if something happens to you and you can't tell me the answers, to the questions that I have? And so, and then also adding the, if you fainted, who would, who would we call? Because that's really an important thing. Who would you let pick you up from a colonoscopy or something like that, just somebody who knows where you live and what your phone number is, those kinds of things. But there's all kinds of free tools out there to do that. And so, certainly the Conversation Project is a great website that helps people walk through that, both providers and, regular folks. There's Prepare for Your Care. There's a woman researcher, Rebecca Sidori, who's done a great job of evidence-based words to say and the documents to use, and those are free as well. A company called My Directives also has a free app, and probably the most well-known of any of those documents is 5 Wishes, which a lot of hospices use that document, and certainly other organizations, and the organization that I work for uses My Directives and 5 Wishes. And, 5 Wishes, wish 1 is who would make decisions for you. Wish 2 is what kind of decisions would they make. And wish 3, 4, and 5 are really about spiritual and community things and how you've lived your life. So the wish 1 and 2 are the most important pieces of that for us, but it's certainly important to know all the other spiritual things that are important to people as they go through their journey with an illness.
Yeah, thank you for taking us through some of the resources. I, of course, now have to shamelessly plug Caring Info, resource of the Alliance, which is free for anyone, really consumer focused, but providers can use that as a tool in having those conversations as well. And actually, Dr. Nelson and I just got to be together in person because we're both part of a grant that helped disseminate some of these communication principles to various communities. And so we're fresh off thinking about this and the role that this can play in the healthcare community and really nationwide. So it's a fantastic conversation to be having this week. But I do want to flip the script a little bit and now go back to kind of the individual or consumer perspective and thinking about, let's just say you don't feel like your provider is bringing up the conversation and you would like to initiate it. Can you do that? How would you start that? What does that look like?
It's really interesting. The numbers are, astronomical, like, greater than 85% of people wish they had a conversation with their doctor, and yet less than 10% of people do. And so, physicians or healthcare professionals really feel like, they're stepping on toes or are concerned that patients might think that they're not hopeful about them if they even bring this information up. And so I would just encourage people to ask how they're doing and say, I really have thought about if things aren't going to get better, what kind of things are important to me. And, to name another group of people, the American Geriatric Society and the John A. Hartford Foundation have really worked with CMS to do the 4M project. And one of the M's is what matters most. And so I think, at least I'm trying to train our new physicians into really asking what matters most to people. Because if you don't ask them what matters most, then you can't fulfill, those goals for them as far as their medical care is concerned. And so I think patients are much more able to bring it up. And I certainly think of baby boomer women who really changed how babies are born in the United States. And I think that group of women, too, is sort of advancing like how they want to lead this world as well. So not to negate all the other efforts of everybody else, but certainly, there's a movement to say, hey, what about me? This is how I want to be taken care of. Some people, though, still think it's taboo, that if you talk about it, it might happen. And that's really frustrating. And so we try to get around it just by having it be much more of a, I won't say a casual conversation, but much more, comfortable bringing it up. I laugh about a patient that I took care of years ago who was in his 90s and had a bad heart and still played masters tennis. And so when we were having a conversation about his heart, and he said, well, I'm having to play 2-bounce tennis now. And so he let the ball bounce twice instead of once before he hit it. And he said, so that means my heart's not doing very well. So I guess we need to talk about a few things. And so, patients are pretty good about, knowing what they need to talk about, but also being chicken to talk about it, bringing it up.
The casual approach is interesting. And I think the what matters most piece of it is a good entry point too, because no matter where you are in your healthcare journey, like you should be able to think about what matters most to you. And then from there, that can be the jumping point for those goals that you might have, and that will shift over time as your care does progress or change. But we can all start thinking about what matters most. And then as we grow through life, evolve what sort of interventions would help actually make those goals possible. I love that story that you shared about one of your patients. I'm curious if there's, I mean, I know the answer is going to be yes, but if there's anything else you want to share about what you might have learned from those conversations that you have had with patients, because I can imagine it's really an insightful way to get to know an individual very quickly.
Yeah, sure. But, I think that patients who are diagnosed with a serious illness, honestly, our brains go to the worst scenario and then come back. And so it's not like people haven't thought, "Ooh, I might die from this." It's just maybe I don't want to think about that for, a period of time. Or, sometimes physicians are reluctant to really give a prognosis. And nobody's asking you to be, day, date, time, like the movies. But really, people who have this illness generally do well for 4 or 5 years. And so let's figure out how we make the best of that. I've had lots of conversations with lots of patients. So as a geriatrician, taking care of lots of older adults, I think of another woman that I saw very early in my career who, she said, okay, this is the last mammogram I'm ever having. Well, she lived another 30 years. And she never did have another mammogram. But she was, quite funny, and we negotiated everything that went on. And as she got older, she developed diabetes that she had much more control, much less ability to control with diet. And so she was a lady who played Pokino every week. And I think I finally convinced her to use some bedtime insulin so that she could just indulge a little bit more on the things that her friends made when they were playing their card games. Not that, she shouldn't have been in control, but certainly what matters most to people who are in their 90s is not the same thing as what matters most to people who are in their 30s and 40s and 50s and 60s. And so she taught me a lot of lessons about things that you should ask, can ask, might do, and how you live your life. And she was an amazing lady.
That's another great story. It also makes me really reflect on that. What matters most for someone at 80 and 90 is obviously not going to be this. Well, maybe not obviously. Some people it might be, but likely not to be the same as even that same person earlier in life. And I think about how so often family members of loved ones that are ill, and maybe they're at least in denial to some extent, are trying to fix it with the right diet or the right exercise regimen, when it's just like, at this point, this person really just wants to do what makes them happy. And like, what are we gaining from pushing this forward? So that's an important thing that you brought up there that I feel like we don't talk enough about. Like, maybe it is okay to just say at that point, we made it this far, let's just spend the time how we want to spend the time.
She was a funny lady in that she says, I take a lot of these pills and I'm not sure that any of these pills are better than M&Ms. And maybe I could just pretend these are red M&Ms and these are yellow M&Ms and these are green M&Ms. And, M&Ms have sugar, they have fats in them, so, and a few other things, obviously.
Yeah. They're the cure-all.
Anyway.
Not a paid promotion. That would be nice though.
No.
Well, we've covered a lot of ground. Is there anything else that we didn't talk about today that you feel like is really important to have addressed in this conversation?
I think that people should take the time to think about these things and then to complete documents. And then the most important thing is really to tell people about it. So if you've named your, middle daughter as your healthcare power of attorney instead of the oldest son, then everybody should be aware that is the order of things. I also think of my own mother, my oldest brother, who is a finance guy, was her healthcare power of attorney, and he was working a lot out of the United States. And I was like, Mom, why did you name him? Oh, because he's the oldest son. And so there's a lot of sort of history where the oldest son is the decision maker, when in fact the youngest daughter may be the one who's the closest, to mom or dad or whoever to make those decisions. And so I just think it's important to make the best decision, and then tell people about it. And certainly if your health system allows you to upload the documents into your medical record, that's great. While we do have electronic health records and they sometimes talk to each other, sometimes the documents aren't able to be transferred from one place to another. And so, my dream world really would be that we have some way to have our documents through a health information exchange that are then accessible anywhere you go, in the country. That somebody can at least look at them, that has the ability, has a need to look at them through, the privacy sort of things. But, that would be wonderful. We're a pretty mobile society. And certainly in the Northeast, you can go from state to state and within an hour, as opposed to if you're driving from Houston to El Paso, it's a long way. And so you're in Texas the whole time. But, something that's a portable, much more portable document, or that can be seen. And so sometimes I tell people, put it in your notes on your phone, or carry have the documents uploaded into a little flash drive that you keep on your keychain so other people can access, and then don't put a password on it so that nobody can access it.
Yeah. No, thank you for bringing up the communicating about it part. That's obviously a really crucial part of it, because what's the point if no one knows what your wishes have been documented as? Caring Info does have more information as well about like different ways that you can store digitally, physically, how you should talk about it with folks in your life. I do think that's an important part of the conversation. And you think that, to your point about an electronic exchange where we could actually access this easily, or providers could access easily across networks, you think that would be something that we could do in 2025, but I know we're not quite there yet. So we'll keep hoping, wishing, and working for that to be the reality someday, hopefully soon. And then as a provider yourself, as a physician, we have a lot of providers listening today. And if you could impart one piece of wisdom, regarding advanced care planning, and again, calling on all of the experience and what you've learned and in these conversations yourself, what would you leave them with?
I really think it's important to normalize the conversation and say that to people. I ask all of my patients what matters most to them, and some of what matters most to them is to make sure that they have the right person making decisions if they can't make decisions for themselves. And so, being upfront, telling them that's what it is. It's for emergencies. It's, if you are able to speak for yourself, you get to. And that's actually sometimes some of the controversy in that if somebody's been named a healthcare power of attorney and they don't like what mom or dad has decided, that they think that they can overrule it. And so it's really given the patient the authority to, let people know what matters most so that they can get it for themselves.
Thank you. I feel like we've covered a lot of ground. It's so important that we continue to, like you said, normalize these conversations, have these conversations in every setting that we can, and empower everyone to be able to make informed decisions about the care they want to receive before they're at a crisis point. And so anything we can do to keep this movement moving forward, if it's the boomer women, if it's us, if it's everywhere, that everything we're doing is great. So thank you.
There is one other thing. So believe it or not, families get together for Thanksgiving more than any other holiday. And so it can be a source of conversation. I'm thankful for having a great family, but I want to make sure that everybody knows, who my decision maker would be and what kind of decisions I would make. And so that's kind of a plug for Thanksgiving. And then I'm also going to give a plug for National Healthcare Decisions Day, which is April 16th. Stay on the lookout for that date and all the things that go along with it, where there'll be other resources, but certainly don't hesitate to make those decisions and write them down.
Thank you for bringing up the Thanksgiving. I hope that's like maybe an easier conversation than politics these days. So Advance Directives for the win. It was a pleasure to talk to you today. Thank you for joining the podcast. If you take anything away from our conversation today, know that advanced care planning is a gift that you give your future self and even your loved ones. So take 20 minutes and get started today. We'll see you next time.